Well, the data, I think, are actually more consistent than inconsistent. Now, it is true that the different trials had different outcomes in terms of the strength of the evidence. But if you look at the totality of the data, it's very clear that SGLT-2 inhibitors do reduce major adverse cardiovascular events. They appear to reduce significantly hospitalization for heart failure, and they appear to reduce renal deterioration in patients with diabetes. I don't think we have enough data to say that one of these drugs is superior to the other, it has better outcomes than the other, even though there are some differences in the trial. You have to understand that in these trials, different kinds of patients were enrolled, and so the differences in the patient population may drive the different outcomes. It really looks like a very good class, and what's interesting about it is nobody saw it coming. When drugs were being developed, if you go back about 10 years, I was the one that proposed to the Food and Drug Administration that they require cardiovascular outcome trials for diabetes drugs. It was very controversial at the time, but it was because we had some evidence that there were drugs that might lower blood sugar but actually increase adverse cardiovascular events. And as the drug classes came about, a lot of people thought that the DPP-4 inhibitors would actually prove to be beneficial. And it turns out that they have no benefits whatsoever. They only lower blood glucose modestly. They have no cardiovascular outcome benefits, and in some cases they actually increase, at least in one of the drugs, seems to increase heart failure. The SGLT-2 inhibitors, why would anybody expect a drug that makes you leak glucose in the urine? Why should that reduce, cardiovascular events? But it did. And it's why we proposed doing this in the first place. Because until you test these drugs in randomized controlled trials, you really don't know what works and what doesn't work. We got a really interesting result with the SGLT2 inhibitors, and we got interesting results with the GLP-1 agonists.